As residents of Mui Wo, Mr. Yeung, his wife and her mother can access outpatient services at the Mui Wo General Outpatient Clinic, operated by the Hospital Authority. The authority currently operates general outpatient clinics on various outlying islands, providing services during regular consultation hours that are comparable to those in urban areas. But what options do residents have if they experience discomfort outside of those hours? Last month, Mr. Yeung noticed an abnormal increase in his heart rate. Despite it being outside of the clinic's outpatient consultation hours, he was still able to receive medical attention there.
I experienced a significant rise in my heart rate, going from over 80 beats per minute to over 130 beats per minute. As my condition worsened, I promptly sought assistance at the Mui Wo first aid post. The medical staff quickly conducted an electrocardiogram and administered injections. When my condition stabilised slightly, they promptly arranged for an ambulance to transport me to the hospital. After a 2-day observation, I was discharged. Without the availability of first aid post services, I would have had to wait for an ambulance to arrive in Mui Wo and then be transported to the hospital, resulting in a significant delay.
The Islands District has a total of 7 general outpatient clinics. In consideration of their remoteness from other health facilities, the Hospital Authority has established 24-hour first aid posts at 4 of these clinics. 2 of the posts have registered nurses available to assist local residents in case of emergencies, while the ones at Mui Wo and Tai O have both doctors and nurses on duty.
With 2 purposes. One is to handle some of the cases which can be handled by the clinic doctors at that time and settled and maybe follow up in the daytime. And the second purpose is to treat those patients which is relatively severe cases, to let them relatively stable first before they go to the emergency department through the ambulance.
The first aid post serves as a miniature emergency department, providing treatment for a range of injuries and serious conditions such as heart attacks and strokes. Dr. Shek has nearly 25 years of clinical experience, including 18 years working in outlying islands, and recognises the unpredictability of life. He recounted an incident where an elderly woman suddenly collapsed upon leaving the clinic after a consultation. Dr. Shek and the duty nurse swiftly shifted their focus from outpatient work to providing immediate first aid assistance.
We detected she has suffered from the ventricular fibrillation, so we need to give delivery, the shock for her, and also give some medical treatment. And then afterwards, she get back her pulse and all. And then we call the helicopters and send to the hospital for further treatment.
Dr. Shek emphasised the need for doctors to prioritise emergency cases, as similar situations can arise unexpectedly.